What's going on, everybody?
Hey, hello. How's everyone doing? Welcome back to Getting That Medical Degree. Today's topic, we're going to talk about depression in relation to the Naplex test. So take it away.
Yeah, so depression is a major topic that everyone should really know about really well for your Naplex. Really, any test in general for nursing, medical school. You'll see these drugs used in this chapter pretty much in any psych disorder, no matter what it is. These drugs are used everywhere, so you really need to know them.
These are really popular drugs.
So this is pretty much the video that you need to watch to know the drugs, because the next couple of videos are going to be anxiety, schizophrenia, and stuff. And I'm not going to go over the drugs again. I'm just going to tell you what the drugs are and not go into detail. This has all the details you need to know, though. So let's get into it.
All right.
So first, you have the diagnosis of depression, which uses the DSM-5 criteria,
Mm-hmm.
which as pharmacists we don't really care too much about that, but it's good to know like where you can go to look it up if you need to know more about it. So look at mood, sleep, the interest of doing stuff, guilt, how much energy they have, can they concentrate, what's their appetite like, how's their psyche doing, are they suicidal or not. If a patient's suicidal, you might avoid certain drugs, such as like TCAs. So that's something to know about. And also rule out like bipolar to avoid inducing mania and stuff into patients. So knowing their diagnosis and like going from there, it's kind of important to know. But the treatment ideas, a SSRI or SNRI are usually the first line agents. So we'll go in a little bit more detail about those. But these are like your citalopram, your Lexapros, escitalopram's, venlafaxine, stuff like that. Stuff.
Fluvaxine, mostly known as Favirin. Yeah.
Yeah. So these are like serotonin drugs.
Fluoxetine is the Prozac and Oxactin and
Yeah, like those drugs. You see those drugs up pretty often, especially in the pharmacy and stuff. So SSRIs in pregnancy can cause persistent pulmonary hypertension in newborns. You kind of want to avoid those if they are pregnant. And there is a drug class called Maois, and they are restricted to patients who are unresponsive to other treatments. This is mostly because these drugs actually interact with a lot of other medications, and they can cause serotonin syndrome, which is like diarrhea, agitation, tachycardia, hallucination, severe nausea. But I mean, all these can kind of interact with, but MOAIs interact with more so. So if they're an SSRI, you don't want to probably put an MOI to avoid that. You really don't want to be doubling up on a class. So you don't want to give them like two SSRIs or something like that. So that can cause a serotonin syndrome. And you do want to taper the antidepressants over several weeks, except Prozac or fluoxetine. That you don't need to taper at all. It takes about 48 weeks at a therapeutic dose before switching, which is really important to know because like if you start Celexa or citalopram at a low dose, that's not really therapeutic yet, and you're complaining it's not working after like 2 months. Well, maybe you should increase that dose to like a therapeutic dose first, and stay at that dose for like 2 months before you complain about it. This is why like getting treated for depression or like anxiety or anything is pretty hard to do because you have to be on that medication for 2 months to see if it even
a
works for
long
you.
time.
Like it's gonna be a long 2 months, especially if you're a really bad case of depression. You know, so that's why it's so hard to get it right. Because everyone's different too. So they can use drugs like Busbar, bupropion, or like low dose atypical antipsychotics such as like Abilify, Zaprex, or Seroquel as well to like add on with these at like a low dose. So getting into the SSRIs, they do have a 2 week washout period before using the MOI. It's at 5 weeks, so there's 5 weeks for Prozac, which is again a question they'll probably ask you about because it's like it's a question they teach you in school. They really stress this a lot in school, and they ask you something like this. They'll try to trick you up to. They'll be like, "Oh, this person's on SSRI, but it's fluoxetine or Prozac," and they'll be like, "What's the washout period?" If you don't think about it for a second, you might just pick 2 weeks instead of 5 weeks. So But the drugs are citalopram, which is Alexa, escitalopram, which is Lexapro, fluoxetine, which is Prozac or Serafilm, paroxetine Paxil or Brizadel, and then sertraline, which is Zoloft. Again, don't use them with Maois or Zyvox. Zyvox is linezolid. It is a drug that is used to treat gram-positive infections. So, something to keep in mind there. So the side effects from these are decreased libido, which is like sex drive, and Prozac is the most activating of these drugs, and Paxil was the most sedating. Also, paroxetine or Paxil was associated with a lot of weight gain, so something to keep in mind too. There's also like an increased bleeding risk with these medications if you're using anticoagulants and NSAIDs. Zoloft is in cardiac risk patients. Also, you have QTC prolongation with citalopram. So, this is a pretty loaded lecture and video, so guys, it's a lot to take in. A lot of details on these slides. Take your time going through them. So, next up, we have a little bit more details about citalopram. So the max dose is 40 milligrams per day, and 20 milligrams for people over 60 years old, not milligrams. Because higher doses of citalopram can increase the risk of QT prolongation and torsades. So something to keep in mind as well. There also are some combinations of medications. So you can have vildaxodone. You want to take that with food, which is probably the main thing they'll ask in your tests. And then it also has less sexual adverse effects. So the sex drive aspect of SSRIs is pretty bad. So maybe you want to use like vildaxodone or something. So then you also have Vorti, I like to call them, or Trintellix. I actually just saw an ad of that on YouTube today. I'm like, huh, okay. But yeah, there's another combination, guys, you could see on your test. SNRIs, so again, 14-day washout period, increased bleeding risk with the anticoagulation. Venlafaxine, Effexor, Duloxetine, Cymbalta, Venlafaxine, Prestique. Again, contraindication if you have MOAIs. You have hyponatremia, fall risk. So you have the same side effects as the other people, as the SSRIs, but now you have increased heart rate, dilated pupils, and excessive sweating and constipation. And the blood pressure in QTC is worse with Effexor. So just something to keep in mind to like separate some drugs from the other ones. Then you have TCAs, these block acetylcholine and histamine. So pretty much you need to know the MOA of the drugs, just how the drugs work. And then you have the tertiary amines, secondary amines. I honestly don't think they're actually going to ask you like what drugs a tertiary amine. I just put that on the slide just for completion purposes. So there's that. Again, the contraindication is the same thing. MOAI, Zyvox, methyl blue. Now, TCAs, they are drugs that you don't want to use if the patient had suicidal attempts or is thinking about suicide. They're kind of easier to overdose on. And they'll cause like a really bad QTC prolongation. So, and the side effects are your anti-muscarinic side effects kind of. So like drying you out. So you have dry mouth, blurry vision, urinary retention, constipation, weight gain. These are pretty much the common side effects of like anything that's anti like acetylcholine, pretty much, or muscarinic. And then you have this class called like dopamine NE reuptake inhibitors. It's basically bupropion, which is Wellbutrin, or if it's for smoking cessation, as we talked about before, is Zyban. Same contraindications again. And side effects are like dry mouth, CNS stimulation, tremors, seizures, weight loss. And sexual dysfunction is rare, which is why this drug might be used in some patients. So, MAOIs, you have a hypertension, crisis risk. The drugs are like aso carboxylate. Basically, you know these drug names. Since they do interact with a lot of medications, you need to know these drug names. They are weird, know them, commit them in memory. So also know that segline is a patch, and it's a MAOB inhibitor. So and avoid like aged cheeses and stuff like this, and like that sekura I think it's called. It's like a weird sausage thing food. So just a couple details to keep in mind. And some random antidepressants. Mirtazapines, Remeron can help with sleep and increase appetite. Trazodone inhibits your 5-HT reuptake and blocks H1 and A1. Sedation, priapism. And then you have nifazodone, which it's hepatotoxic. So what do you use if the depression's not getting any better? You go to some of these agents such as like Abilify, which is anxiety, insomnia, or Seroquel. So Seroquel or cotinapine can cause a lot of weight gain as well. Paxil is also one that can cause a lot of weight gain. This is usually used in like Parkinson's patients who doesn't have a high EPS risk, which is like I don't know how to explain it. We'll get there when we talk about Parkinson's. I'll explain it more there. Keep in mind, quetiapine or Seroquel used in Parkinson's patients due to the low EPS risk. And then you have a olanzapine fluoxetine combo, which is Symbyax. That can cause sedation, weight gain, increased lipids, and glucose. So that's it for depression, guys. Hope you guys learned something. Do you have any questions, Mitchell?
No, that was pretty informative.
So everyone have a good night and see you next one. We'll talk about anxiety and stuff. So peace.
All right, guys. Thank you so much for coming. Comment and subscribe. Give it a like if you like the video and subscribe. Thank you.